Welcome back to Breathing for Better Sleep with Dr. Fred Eck, the podcast that explores natural root cause solutions for sleep apnea, snoring, and childhood sleep issues without CPAP or surgery. Today's conversation is one you'll want to share. We're talking about the 80%, the people struggling with poor sleep, brain fog, and misdiagnosed health issues, who never get told it could be a sleep disorder such as sleep apnea, upper airway resistance, and mouth breathing. Dr. Eck breaks down how the healthcare system misses these patients and why it might be happening to you or someone you love. Dr. Eck, when you say 80% of people with sleep apnea go undiagnosed, when did you first realize the scale of this problem?
Known it for a long time. We've been treating sleep since 2002, but really when I would say it really popped was when I myself got diagnosed with sleep apnea because I happened to be at a conference where they gave us these tests to do for somebody treating sleep for years who didn't know they had sleep apnea. So when I got a sleep test done and it turned out I had severe sleep apnea, that's when I started this journey of trying to figure out there's got to be a better way to screen people rather than simple questionnaires that miss half the people, or just looking at somebody and only picking those people who are overweight to screen for sleep problems.
So what kind of people get misdiagnosed by the standard sleep apnea screening, or why are some people tested for sleep disorders and some people are not being tested?
Everybody of all walks are going undiagnosed. 80% of people with a sleep disorder are going undiagnosed. And the people who are most commonly missed are those people who don't fit the prototypical look, the big neck, the overweight. So if you have a skinny female, then most people are not screening her for airway. Most people are not screening children for airway. But yet, if you have children that have certain things going on, such as chronic ear issues, their mouths are not developing, they have early orthodontic problems, crowding, growth and development, behavioral issues like ADD, ADHD. These are all signs that these kids probably have a mouth breathing or actual sleep disorder. And so they're just, because they don't look like a sleep apnea patient, they're just going undiagnosed.
And how can these people know that they need to be screened for sleep apnea if they don't feel like they themselves fit the criteria? Because I know my father, he's like pretty slim and he eats well and he's active and everything. But the only reason why he found out that he had sleep apnea is because he can't sleep. He had insomnia. But I'm sure there's a lot of people that don't have insomnia that are thin, like you say, and don't fit that criteria, but do have airway problems, right?
Yes, there's a lot of people who, don't fit the typical protocol. But you can look at things like symptoms, okay? They're tired, memory fog, heart difficulty concentrating. You have anxiety, depression. You have lots of different things that you can look at in your medical history, things that are related to sleep apnea. And for instance, blood pressure, blood sugar problems. The most common cause of these problems is a sleep disorder. So rather than just treat the high blood pressure with medication, anybody that has that or AFib or any of these things that are commonly caused by a sleep disorder, they should be tested for a sleep disorder, whether they have symptoms or not.
Yeah, it's interesting because a lot of people might feel very crazy that they have all these symptoms, but no one's able to pinpoint what the root cause is. So it's good to create an awareness that way. And how are we missing 8 out of 10 cases? Like what's broken in how we screen for sleep apnea and sleep disorders?
Well, we're using things like Epworth sleepiness scales, things that were created years and years ago, right? And they're not very accurate, not very specific. And so if we want to get people screened properly, we need to take 3D images of airways. We need to review medical history more closely and start paying attention to those things that could be caused by the airway disorder. Sleep apnea is only one sleep disorder. There's over 60 sleep disorders. And in skinny females, especially TMJ and headache patients, the most common sleep disorder is upper airway resistance, not sleep apnea. So that can create a lot of problems as well because you get a sleep test done. I just had this happen last week. The lady came in to see us because she had a sleep test done. She's very symptomatic, and her doctor said, "You're okay. You don't have sleep apnea." Well, I reviewed the sleep test with her, and she has pretty severe upper airway resistance and fragmented sleep. So if you don't stay in deep sleep, then you can't regulate hormones and you get brain fog. If you don't stay in REM sleep, that creates a lot of behavioral issues in kids. So we have to look at the disorders in addition to sleep apnea as well, because there's lots of them. Insomnia is probably the third most common sleep disorder, but it most of the time has a root cause of sleep apnea or upper airway resistance.
Okay, so insomnia is a disorder in itself, or it's also a symptom of a sleep disorder?
So it can be both. So people oftentimes have insomnia, but that insomnia can be caused by lots of different things. And having sleep apnea or upper airway resistance and creating what's called fragmented sleep, where you're not staying in your proper stages of sleep, can be the root cause of the insomnia.
And what is upper airway resistance? How is that different from sleep apnea?
So with sleep apnea, the definition of an apnea is you stop breathing for at least 10 seconds at a time. Let's say you stop breathing for 6 seconds. Okay, let's say you don't stop breathing 100%, but you get 50% resistance in your breathing. Those are upper airway resistance. It's not by definition an apnea because an apnea has a very specific definition of stop breathing at least 10 seconds.
Oh, I see. And would you say that this is now a personal question because I see a lot of women struggle with like thyroid issues and hormonal imbalances. So you say you would encourage these women to get tested for sleep?
Yes, because if you're not staying in deep sleep, that's the stage of sleep which your body regulates hormones. So if you're not staying in deep sleep, that can throw off and your body is unable to regulate hormones. So anybody seeing, let's say, an endocrinologist for hormone therapy or a wellness doctor for hormone therapy should have an airway test done to see what their stages of sleep are like, because it will help the performance of what they're trying to do.
Yeah, this is very insightful. Me as a person who struggles with thyroid and doesn't get any guidance or like we just get hormone replacement therapy and that's pretty much what endocrinologists do, but they don't really guide you on what else you can do to optimize that. And it's insightful that you mentioned if you're not sleeping well, how are you actually going to recover from hormonal imbalances?
Yeah, most people are treating the symptoms. They're given a medication to treat a symptom, not actually getting back to root cause of what's causing their problems.
And what's one question that you ask during your consultations that most doctors never ask, but changes everything?
Well, it's related to what we just talked about. There's lots of things in a patient's history that can be a sign of airway problems, especially childhood airway problems. Things like ear issues, like chronic infections. You had to have ear tubes put in as a child, okay? Tinnitus or ringing in the ear, TMJ issue, headaches, vertigo. These are very, very common issues that we see with as a comorbidity with a sleep disorder. So if you ask about these things, you get a better idea of the likelihood that this person could potentially have a sleep disorder.
Wow, I've never heard that vertigo could be related to sleep disorders. And it's interesting because another example, but I think a lot of people relate to this. My mom has vertigo, and it's one of those things that nobody really knows what to do with. They just kind of like treat you for symptoms or rest, but not a lot of physicians know what to tell these patients.
No, they just they treat the symptoms. And if you got to get to the root cause of what's causing the vertigo, right? The vertigo can be exacerbated in a TMJ patient and a sleep patient that has what we call an epigenetic component. So our balance comes from the cochlear bones that are behind the temporal bone. Well, a patient can grow asymmetrical to where one side of the temporal bone is higher, the other one is lower. And you'll commonly see one eye higher or lower than the other, one ear higher or lower than the other. And if your temporal bones are starting uneven, your body can't balance itself. So you got to get to that root cause of that epigenetic growth problem.
And is that something that is very noticeable, or you would have to study to see that imbalance? Like,
Usually we can see it. If I see a photo of somebody, and if they have long hair, put the hair behind the ear so you can see the tops of the ears, the eyes. And then we do our 3D images that allows me to see what the skull looks like without the skin in the way, right? And the combination of those things, if you have those issues, we can see it pretty quickly. Takes about 2 minutes to figure it out.
and that's something that can be corrected, like the placement of the
Yep.
body, or yeah, like at a physical level.
Yep. Yeah, you can you can release those cranial sutures and get balance, more evening of the eyes. There's lots of ways to do it. We do it through epigenetic oral appliances. Craniosacral therapy is out there. What they call nasal release procedures. There's different ways to do that.
Oh, that's pretty cool. And what's one thing you wish every doctor knew about diagnosing sleep apnea properly?
Well, to me, it just always comes back to the root cause. I just wish when a patient has a sleep disorder, especially when they're symptomatic, if your physician tells you your 5-year-old child's vision is not good, do we wait until they're 25 or 20 to correct it or work on it? We don't. But yet, when you see these signs that somebody's developing an airway problem, we want to just quote unquote keep an eye on it, right? So when somebody has these symptoms or signs of having a sleep disorder, rather than just throw a medication or a mask at it, I wish most doctors would stop and get to the root cause so you can actually help cure the patient.
Yeah, because otherwise there's like humans that are having pretty poor life quality of life because they're misdiagnosed.
I mean, we just had a patient this morning who's been on a CPAP mask for 18 months, no success. He can't wear it. It's not helping him. When I do his 3-dimensional image of his airway, his nasal airway on his right side is 100% obliterated. It's 100% blocked. So you can't possibly force enough air down the airway in order to overcome that restriction. If you try to turn the pressure on the mask up high enough to do it, then the mask becomes intolerable.
And what are the nostrils blocked with? Is it polyps or?
It can be. It can be enlarged tissues from chronic allergies. Most of the time, it's one of these epigenetic growth issues. They did not develop. So our hard palate, our bone in the roof of our mouth, is the same bone as the floor of our nose. So if you have a narrow or vaulted palate, you have a narrowing or alteration in your nasal airway. So that can be a cause. Enlarged polyps from inflammation can be a cause. So there's different causes, but again, get back to root cause, what's causing it. If the problem is the narrow palate and we go in and do a nasal surgery, the relapse rate of these nasal surgeries is in the 80%, 83, 85% failure over 3 years because root cause not being addressed. So if the palatal expansion becomes the solution, then if you do that first and then you still need a nasal procedure, the nasal procedure will actually work because the root cause has been addressed.
How do you identify the root cause? Like, what would be a possible root cause for that scenario specifically?
Mouth breathing as a child is the most common cause. As a human, we're designed to breathe through our nose. If we breathe through our mouth while we're growing, and particularly before the age of 14 or 16, our jaws will grow narrow, not out like they're supposed to.
And is that something behavioral that could be corrected, like you teaching perhaps a child to breathe through their nose, or is it?
That's the most common treatment for kids is we teach breathing techniques, we teach proper tongue position, we try to break the habit. Mouth breathing becomes a habit. Like all habits, it has to be broken, right? So you got to start retraining nasal breathing and getting away from the mouth breathing. And if you accomplish this with proper swallow and proper breathing, the jaws will start growing again. And you can a lot of times eliminate the need for orthodontics if you get the jaws to start growing again.
That's so interesting that our habits do really shape our bodies.
And in the airway world, it's called myofunctional problems. We have a myofunctional or an improper tongue posture or an improper swallow.
And if someone feels fine but snores or breathes through their mouth, how concerned should they be?
If you're breathing through your mouth or you're snoring, what I always tell people, if you're pre-diabetic and you don't pay attention, you don't watch your diet, you don't take a medication, you do nothing, what's going to happen? You're going to become diabetic. When you snore, if you ignore it, it's not if, but when you're going to become a sleep apnea patient. Sleep snoring is 100% abnormal in humans.
100%.
Abnormal. Mouth breathing, with the exception of a few breeds of dogs, humans are the only mammals. How many mammals are there? Like 6,000? And we're the only mammals, with the exception of a few bulldogs, right, that breathe through our mouth and have crooked teeth.
So naturally, we would have straight teeth. Like if we developed properly, if we breathed properly, we would have.
Correct. Crooked teeth is abnormal. There's a cause. There's a root cause to crooked teeth. It is not genetic.
Okay. So for the people that get orthodontics, sometimes, for example, in my case, I got braces when I was younger. But the crooked teeth that I had in the bottom are now crooked again. They weren't for the longest time, but then they got crooked again. And I thought, oh, okay, maybe it's my wisdom teeth putting pressure and pushing them and making them move.
That's a misconception. Your wisdom teeth cannot apply enough pressure to move your front teeth. In fact, if you look at statistics, having orthodontics on an adult dentition, so pretty much 12 years old and later, right? Here's the statistic. Your orthodontics is going to fail or relapse, at least partially, 90% of the time over 15 years, even if you wear your retainer. If all you did was cosmetically go in and do orthodontics, okay? Mother Nature puts your teeth in a stable position in the middle of bone, in the middle of your tissues. So it's stable. They won't move. You might have crooked teeth that are uncosmetic, but they're going to stay there. That's where Mother Nature put them. So now if we just go in and do orthodontics and blow those teeth out and cosmetically where we want them, your body knows that's not the stable position. And your body, tongue, everything else, your tongue's the best orthodontist there is. Your tongue will reposition everything. So, yeah. So if you have a root cause like a narrow palate or mouth breathing, then you want to address it. In kids, we do a lot of myofunctional therapy to correct the myofunctional problem so that you can do orthodontics and it will stay stable over a long time. If you don't deal with the mouth breathing or the abnormal swallow or tongue posture, then their orthodontic problem will relapse and come back because you haven't dealt with the root cause.
And this is different for every case. So if a person has crooked teeth, would that be also a reason to visit a sleep doctor? So I have crooked teeth, so I would come and visit you.
Yes, crowding in your teeth is a sign that you're getting abnormal pressure against your teeth, making them move, or they're not centered in bone or a combination. So it could be a skeletal issue, like an epigenetic issue, like we talked about. It could be a mouth posture or tongue posture, like people who are tongue tied, who can't raise their tongue up to their palate where it's supposed to be. That's a myofunctional problem that's easy to correct. And if you do that, it will make your orthodontics stay stable.
You mentioned your tongue needs to be at the roof of your palate, slightly against your top front teeth.
Actually, not touching the teeth, right behind them. On the soft tissue right behind the upper front teeth is where your tongue. So to breathe normal, we are supposed to have our tongue on what we call the spot, okay, right behind the tissue, right behind your upper front teeth. And we should have our mouth closed, tongue in that position, and breathe through our nose. That is normal breathing for a human. If we're altering that in any way, that is abnormal.
So it shouldn't be touching the teeth.
No, it should be touching the tissue behind the teeth.
Okay. So I already got that wrong. Okay, okay. So you've said sleep apnea is a progressive condition. If someone doesn't know they have it now, what might be what might it become later?
Well, it's kind of like if I have a small problem, right, and I ignore it, it's going to turn into the bigger problem. So sleep apnea and sleep disorders can be essentially mild, moderate, severe, right? And like anything else, the more severe it gets, the more complicated, the less predictable, and the more expensive it is to treat. So you want to treat early and you want to treat while it's easy. You don't want to wait. You get a cavity in a tooth, you want to go fix it while it's a filling. Don't wait 2 years where it turns into a root canal and a crown or an extraction. Fix it while it's easy. And ultimately, it will. Sleep is progressive. If I do a sleep test on somebody and I redo their sleep test in 12 months, if they've done nothing to correct it, their sleep test is worse by the year. It is progressive.
So there's a lot of responsibility on the patients as well.
If you want to treat sleep, there is a lot of compliance that's needed by a patient. There's things that they have to follow and do to get success. So there are patients who won't comply, just like there's patients who won't brush their teeth. There's patients that won't take their blood pressure medication. If you have patients that aren't compatible, that's who we normally do the surgical stuff on. They won't wear something, they won't do the exercises. So those are the people who typically do surgery because you do a surgery and it's done and you don't have to worry about their compliance.
So what would be an example of when you treat a patient, do you give them a program? So a combination of different things like breathing techniques, mouth appliances, like it's a combination of different things, or you choose what treatment fits better for that patient?
Our protocol is pretty much a protocol. It's not an appliance treatment. It's not a this or that. It's a protocol that involves several things. So if myofunctional is a problem for somebody, if tongue tie is a problem for somebody, they have to address them. If they have narrow palates and restrictions in the airways, then we have to get those airways opened up. If snoring is their primary concern, we can make a different kind of appliance, just moves their jaw forward a little bit that gets rid of the snoring. So one, it depends on what their problem is, but then also what is the root cause of their sleep disorder? And we fix root cause, whatever that is.
And can you notice when you're awake the way that you're breathing, and how you can understand how you're breathing how you breathe while you're asleep, while you're awake? Does that make sense?
So when we're doing myofunctional therapy on somebody, if you can't breathe properly with a proper swallow, proper tongue position while you're awake, you're never going to do it while you're asleep. So this all starts with training and doing the breathing exercises while you're awake so it becomes habit. So I did myofunctional therapy years ago. I was a mouth breather. And mouth breathing, as I mentioned earlier, it's a habit. You have to break the habit and develop the habit of nasal breathing. So a few years back, I was in New Orleans at a conference. It was during Halloween, and I had this mask, this outfit that involved a mask that covered my nose. And I have trained myself to be such habitual nasal breather, I could not wear this mask because I can't breathe through my mouth comfortably because I've gone to such the other extreme to train myself to breathe through my nose. So it just has to be a training thing. And if you do it during the day, then ultimately our goal is to make it habit so we do it at night when we sleep when we're not conscious about it.
That's so interesting. Even well, hearing you speak, I noticed I've never noticed myself to be a mouth breather, but I do touch the upper front of my teeth, back of my teeth, but and I just put my tongue a little bit. I moved it a little bit more backward so that it's just touching the tissue, but not the teeth. And I did feel like it opened up my airway. Does that make sense? Is that what happens?
Yeah, it doesn't take long. Some people can do myofunctional therapy for as little as 3 to 6 months, and it develops that habit of nasal breathing and proper tongue posture.
Okay, and that depends on how severe the problem is or how disciplined the patient is.
How severe your problem is. So, for instance, if somebody has an extremely vaulted upper palate, Well, that's not the shape that your tongue is looking for. So for that person, they may have to develop some arch or palate development before they can even do the myofunctional therapy because it's too difficult to get the tongue to stay there because it's not shaped right.
Oh, I see. So it's a sequence for a sequence of treatments for some patients.
Right. Yeah, you don't throw everything at one time. You got to look and see what the causes are and address the most common cause in a sequence. And sometimes you can do multiple things at one time, and sometimes you got to do one thing before you can do the next, especially with kids.
Yeah, and I can see how kids are also to treat just because how do you install a habit or how do you change a habit in a kid? It seems like it's easier because their habits haven't been reinforced for so long, but also their attention span.
It's funny because it is actually, for the most part, easier on a child than an adult. It's actually harder to get compliance on a lot of adults.
Okay, because we're more stuck in our ways. And do you find it that kids usually understand what you're talking about?
Yeah, we show them some videos and some animated cartoons to explain everything. We start this at 4 years old. So kids are smart. All these shows they watch on TV. We just have all kinds of little cartoon things to show them the proper tongue position, the proper swallow, and they'll get it. They'll do it. And look, for the most part, the kids really want to make us and their parents happy. So they want to be told they're doing a good job. So they really do comply pretty well.
I bet there's also kids that are treated for sleep disorders, and that inspires their parents to treat their untreated sleep disorders as well when they see their kids are doing it.
It's very common, and it's very common the other way too. We see adults for consults and explain to them this whole airway problem started when you were a kid. That's why you have this narrow palate. And so when they see that this all started at a young age, now they want to get their kids screened. So it's very common when we're treating adults to have them bring their kids in.
So I can imagine how it would really change people's quality of life if they start sleeping better. And like you said, because a lot of them start at such an early age, they might not even know what it's like to sleep properly and feel better because we do get accustomed to living in a particular way or feeling in a particular way on a daily basis. So when they might discover like a whole new way of life once they
Yeah, they don't realize how abnormal their breathing is until it starts to get better, and then they start to feel better.
you were a patient yourself, no? Would you say you have sleep apnea or you had? Is it something that
I had sleep apnea. I do not have sleep apnea anymore. You can actually cure it in some people and get rid of it.
and would you say that your quality of life changed due to that?
Yeah, because as you just mentioned, there were things because I didn't consider myself symptomatic or have any symptoms of sleep disorders, but my focus and energy that I just thought was normal for me. But once that improved, then I realized, man, it really was affecting me.
So it's one of those things that you don't realize they're affecting you until you change.
Yes.
And if we really address this issue earlier, what kind of long-term conditions could we prevent?
Well, all of those things. So a lot of our patients are referred to us for sleep tests because they developed a medical condition that the medical community knows is related to sleep disorders, right? So things like having a heart attack, strokes, neurological issues, and anxiety stuff like ADD, ADHD, depression, AFib, very common. Like 87% of people with AFib have sleep apnea, dementia. 90% of people with dementia have sleep apnea. So if you treat the sleep disorder, you can improve these conditions if you have them, and you can actually prevent them if you don't have them yet.
Because you are at a risk of developing dementia if your sleep disorder is not being treated, right?
Yes. If you're not staying in deep sleep enough, and you're getting oxygen desaturations. Both of those things puts us at high risk of developing memory issues, dementia, and Alzheimer's. So when you treat sleep, it's pretty much the most holistic preventative thing you can do.
And do you find it that it's ever late or no matter how age you are
We treat people in their 80s all the time.
and they can get better and they can still prevent further disease?
Yes. So you have somebody who develops AFib, for instance, and the doctor does a conversion and it's not working. It's not lasting. The sleep apnea was their cause. Oxygen desaturations was their cause of their AFib. So the treatments for the AFib are not working. We just had a guy, 86 years old, who went through treatment because he wanted to do a conversion, and his doctor would not do another conversion until he's treated his sleep apnea.
Oh, I see. And so could you treat someone with Alzheimer, for example?
You can. Those are harder to treat because of the compliance issues a lot, especially if you catch it early on. It's obviously better, easier. But yeah, it's never too late to treat the airway.
Would you say that, for example, for a Parkinson's patient, if they treated that, would it impact?
I have heard there is a correlation with the sleep disorders and Parkinson's, but I'm not familiar with the why.
Okay, I've heard that Parkinson's patients that don't have good quality sleep do get more tremors or more cognition problems, and it makes sense. But I just wonder if how many of them have sleep disorders, and if they were to treat the sleep disorder, would they get better?
I would assume because when you look at epileptic patients, they tend to have less seizures and less severe seizures if they treat their sleep disorder.
Wow, this is very eye opening. There's so much of sleep that we don't really acknowledge yet.
And there's some really good books out there that I wish would become more popular because it would really help patients. I might bring them up in one of the future episodes, but there's books like Breathe by James Nestor, or you have Why We Breathe. And so there's some books out there that are really great for the public to read and understand.
Yes, I'm pretty sure the audience would be really interesting in diving a little bit deeper into this topic because, like you said, it affects so many people and they don't really know. And I remembered you mentioned on episode 1 that there was a book from the 1800s. Am I right?
Yes. Yeah, the book from the 1800s is all about the importance of not mouth breathing. It's the entire book is based. It was written in like I believe it was 1860. So, and it was called "Shut Your Mouth and Save Your Life." And so we knew back in the 1800s the importance of not mouth breathing, of breathing through our nose with our mouth closed.
Wow, that's so interesting that it's such an old knowledge, but it's still underground.
It's definitely not mainstream.
And do you find that that book is an easy read, or is it because it's
That book is an easy read, but because of the time at which it was written, it does have, the English was different back then, but it's easy enough to read. The other book is called Jaws, The Hidden Epidemic, and that's about mouth breathing and children development. That's a real easy book to read.
awesome, Dr. Egg? Well, thank you so much for such an insightful conversation. We're reaching the closing of this episode. Is there anything that you would like to add?
I don't think so. I think we're good. Thanks for having me.
Thank you so much. That is it for this episode of Breathing for Better Sleep. If you saw yourself or your child in today's conversation, you're not alone. Most sleep apnea goes undiagnosed, but it doesn't have to stay that way. Subscribe to catch future episodes and visit sleeptreatmentdirect.com to learn more about working with Dr. Egg.
Thank you.